Good morning, Dylan. Thank you for agreeing to talk to PPF today and for us to find out more about your work. So if you could kick off by describing your research to us.
Thanks, Anne. Yeah, it's really good to be here. So my research is really at the intersection between data science and healthcare assessment. So kind of starting with the problem, I guess, in a lot of health conditions, and the one that I'm researching in concussion, we really rely on subjective techniques, so pen and paper based tests. So I guess my research is really trying to use objective tools such as technologies to help inform our assessment as physiotherapists and improving kind of care for patients. And since 2019, we've been looking at concussion in university rugby union players and using novel bits of technology to really try and improve the way that we assess concussion.
Okay, can you tell us a little bit about that novel technology? So I've seen it described in your applications, but if you could just describe it to us, that would be useful.
Yeah, so one of the real challenges I think we have in concussion is how complex it is. So how many impairments that it can cause and how it can vary dramatically between individuals. So we took a multimodal approach to it. So we're using different bits of technology ranging from cognitive, the motor or the kind of the balance impairments, and also the visual impairments. And that really corresponds to the type of tech that we use. So for the wearables, we're using small kind of inertial measurement units, which is the same hardware and technology in your iPhone and your Apple Watch, but it's really a research grade technology. And then the more novel bits are the eye tracking glasses, which we can use to look at different types of metrics from how people are looking at certain objects, their attention span, but also more kind of finer details in terms of some of the subtle eye movements which might be impaired in concussion.
Okay, so you've done a series of studies.
So we kind of really try to approach it in a systematic way, really by starting at the kind of the gap in the literature. And there really wasn't a huge amount of research in that multimodal discipline. A lot of research is focused on maybe a specific impairment, but there really was, I think, an opportunity to look at it in a holistic way and realizing that it's very unlikely to have a silver bullet in concussion assessment, and we need to have a kind of a suite of approaches. So we started with the kind of a literature review, which we were able to publish in Nature Digital Medicine, which was really good. And following on from that, we kind of approached it in a sequential way. So we had a number of validation studies to check that these technologies were valid. And then we moved to the kind of recruitment and large scale data collection across the university athletes here in Northumbria University. And from that, we've been able to collaborate with partners in the United States and also in Australia. So Oregon and also partners out in Melbourne. So that's been really good, and we've been able to collaborate on a number of projects. But fundamentally, we're using that technology in that healthcare domain in a really translational research area and trying to layer on top of the kind of the physiotherapy practice that we already do in concussion assessment, but really trying to improve things and adding objectivity where we probably can't do that ourselves as physiotherapists. So kind of a practical example is really in that outside of the lab assessment, so the remote monitoring. So can we capture these deficits over a longer period of time rather than that traditional sort of 15-30 minute physio appointment?
Okay, sounds good. So it would be used pitch side as well as then in practice post-injury.
Yeah, so the kind of approach, I guess, in concussion at the moment is really, if there's any doubt in someone potentially suffering concussion, we assume that. We don't really assess for concussion per se. We really just, if we recognize or if there's any doubt, we treat as a concussion. So really these technologies are more for the return to play. So can we track the players or the patient's recovery to baseline? And definitely these wearables, I think, have good utility in monitoring people's walking, their balance, their turning, some of their eye tracking metrics. So can we, after the injury occurred, can we be more certain that they're healthy or recovered so they can go back to their normal activity or sports?
Okay, sounds really, really exciting, useful. So how's PPF helped you in terms of funding your research?
Yeah, no, it's been absolutely brilliant. And I think coming into academia as a PhD student and kind of my clinical background across the NHS, professional sport and the military, it's really kick-started my academic career and allowed me to really first and primarily expand the network that I've been able to be involved in at presenting at conferences. And then more recently with the larger grant submissions and support from the PPF allowed us to expand the scale and the kind of capacity of research that we're able to do. So purchasing new cutting edge equipment, testing on more players across the northeast of England have all been really beneficial. And I think myself and the wider team at Northumbria are really grateful for the continued support from the PPF.
Great, thank you. Well, wishing you all the best of luck and looking forward to hearing more about your research. Thank you, Dylan.
Thanks very much and look forward to chatting again.